Okay, good morning, everybody. It's 9 o'clock. We'll call this meeting to order. It looks like we have all members present, so welcome and thank you for your time this morning. I look for any disclosures of pecuniary interest if there are any.
Mr. Chairman.
Yes, Councillor.
Just a point, I have to go off this call for primary control group at 9:15 in a CPC thing. I intend to come back for the in-camera. Is the in-camera on the same Zoom, or is it a different Zoom to come in?
I believe it is, but I'll just ask staff to verify
that. That's correct. The in-camera will on the same Zoom call.
Okay, thank you very much.
Okay. Thanks, Councillor. Thanks, Stefan. So no disclosures of pecuniary interest, so we'll move on to our first item, which is an update from the Medical Officer of Health, Dr. Renaday. Good morning. We cannot hear you.
Gotta turn it up.
I know it's your usual. Can you hear me now? We cannot hear you.
No.
No, sir.
How about now?
Absolutely.
Okay. All right. Okay. When it works, it's great, right? Okay. Thank you, Councillor. I don't have a very big update today. There's not a lot going on this file, really. We've had two more cases in the last 24 hours, but that brings our overall total up to 278 cases. Still 25 deaths, and 3 more recoveries have happened in the last 24 hours, so that brings us to 238. We have an active ongoing institutional outbreak, which, if there are no more cases, could be declared over by the end of the week. And I think that you'll be aware that on Friday, Lambton County can move along with its neighbors into stage 2 of the reopening process, and that enables more businesses to be open, things like personal service settings, and other workplaces and settings that people can go to. We're getting lots of calls to help interpret the guidance documents around those settings, and so we're doing our best to make sure people have the information that they need to move forward. And where there are big challenges or issues that we're really not clear on, then we forward those to the province for clarification, and then try to share it with all of the folks, either through the internet portal or if we have a separate communication path to them, then we'll just communicate with them directly. So that's it. I mean, I think the thing is, after Friday, we sort of put a timer on it for 2 to 3 weeks and see what happens to cases, recognizing that it's so important to move these things forward, recognizing that it's so important for people to get back into doing a few more of these things, but we'll just sort of remain watchful over on this side.
So will your monitoring strategy change at all come this Friday, knowing that things are opening up?
Not really. I mean, I think that we have several points of identifying surveillance on the disease, right? And we're just going to maintain those points. So one of the points is what's happening in the healthcare system. So we look at acute care capacity, ED visits, things like that. What's happening in terms of the tests that we're receiving. So now that the eligibility criteria has been significantly widened and almost anybody can get, well, basically anybody can get a test at an assessment center, that's one mechanism by which surveillance can be performed. Plus, there's going to be ongoing surveillance in congregate settings. So when we get the test back from those, we'll also see what they say routinely, or really follow up on positives. And so I think that there's lots of surveillance points, also potentially through primary care to identify things that are going on to keep a handle on it. The real piece is to make sure that especially people with symptoms are able to get tested, because that's the highest probability of identifying disease. And then we'll follow up on the other side of that when we get positives.
Thank you. Are there any other questions? Yes, Councillor Bradley.
Yes, Doctor. I think you got notice of this question through Mike Gorgie. Yesterday, we were discussing on the Sarnia Primary Control Group the frustration, I think you've shared it, getting from stage 1 to 2, trying to figure out what the criteria was. Now, the big step is to go from 2 to 3, and we were told by the MPPs on the call the other day that could be 2 to 4 weeks away. Is it possible to press the province to tell us what is the exact criteria to meet this stage 3? Because that's the frustration, right? We don't know what we're grabbing at as it relates to, is it the number of cases? Is it the number of deceased? All those questions. And it would be helpful if there was a better definition so we knew exactly where we need to concentrate what we're doing to get to that stage 3.
I agree with you. I mean, I think it's something that should be more easily accessible, such that other people can look at that information and say, okay, yes, we need it, or at least we understand how they arrived at that decision. I think we saw that in the first round of this. So certainly it's something that you can, or the council can press for clarity as we move into stage 3 to say we want you to make the criteria more explicit, something like that. I think that's fairly reasonable. Certainly, I think that when we had the conversations around moving into stage 2, they were probably looking at similar data. But again, as you say, it's hard to tell unless they tell us what they're looking at.
Now, would that come from public health, or you want that coming from the county, city, the communities? Where would that come from?
It could come from anyone, I suppose. I would say that probably one of the best places it could come from would be from the council itself, because you could say, you know, it's important for the public to be able to understand how the decisions are being made and to identify what the criteria are for moving forward so that everybody can kind of be prepared. And I think that's a fair message to come from the council if that's something you wish to do.
Okay, Mr. Chair, can I ask Mr. Tebow, can I just give a motion to do that right now on the floor, just to simply say that we move this, that we ask the criteria to be better defined for stage 3, and Lambton County needs to know better the rules and the goals that we need to have to get to stage 3. Is that acceptable as a motion right now, or do you need it for at the end of this meeting?
No, I think it's perfectly on the table, given that it's a committee meeting rather than a council meeting, and then it'll go to council on July 8th for full approval.
Is there any chance it could go to the second committee today if it passes?
We can always communicate that, yep.
And I think that would be helpful if we could, and then get it out of here today and not wait till the 8th of July. So I'll move that motion if there's a second.
Seconded. Councillor Napper, any discussion on that? Yes, Councillor Napper?
Would that be in the form of a letter, like a joint letter between Mike and Bill there, or how's that going to work?
I would suggest it just simply go from the warden. Public health reports to the warden, and all the other communities are part of this too. It's not just the city, it's everyone. So I would just move that it come from the warden's desk, and maybe co-signed by the medical officer of health.
It's not that more clout with the more people that I'd like, but you know best.
I think the warden can stress that he's representing all of the communities in Lambton County. And I think it would be beneficial if the medical officer of health would sign it too if he's comfortable with that.
Warden Weaver?
Yeah, I support a letter coming from the warden, similar to the one that we did when we didn't make it to stage 2. We asked for an explanation, and it was fine. So we can do the same kind of letter with or without a motion. I think that could be done to ask for that information coming forwards. But I would support the motion on the letter being drafted. Whether the PM committee supports it, I guess that's here or there. We didn't have a motion to send the other letter. It was done through a discussion, and it was a letter on behalf of everyone. So I'm certainly prepared to do that.
Yeah, I just don't, Mr. Warden, I just don't want to wait till July 8th.
I totally agree.
I'll leave it up to, if the motion passes, leave it to you to make the judgment.
So a motion in short for clarity from the province. Any other questions on that? I see none. All in favor? That is unanimous. Thank you. Any other questions for Dr. Ronaday? I see none. Sir, I thank you for your time and, as always, for the good work that you're doing over there. And pass on our thanks to the staff as well.
I will. Thank you.
Thank you. Okay, on to item number 4, infrastructure and development services. We have, looks like 4 letters to receive and file from various municipalities. Look for a motion to receive all of these letters. Councillor Miller, do you have a seconder? Councillor Ferguson, any discussion on any of those? All in favor to receive those? That is passed. We have a number of information reports. I'll just quickly highlight them. Their COVID-19 service level impact update report, first quarter stats and approval authority activity, July 1st, 2019 population estimates report, work in progress report, building services first quarter, 2020 to 2024 roads construction program report, Southwest Middlesex agreement conclusion report, upcoming 2020 Public Works Conferences report. So I'll look for a motion to receive all of those reports. Councillor Veen, Deputy Warden Marriott seconds that. Any discussion on any of the items? I do see Councillor Bird and then Warden.
Thank you. Through the chair to staff, please. I've just got a quick question on information report H. So to staff, what are the highlights or the most important points on this upcoming December conference that makes it so interesting to attend?
Mr. Chair, just the one in December is, if Councillor can just identify, I think there's several mentioned in there.
The Public Works Conference in Texas.
Oh, yes, yeah. It's, do you know what, so the PWX conference, it's just a North America-wide conference that is presented every year. It's probably the largest public works conference that we have exposure to. We haven't attended, nobody's attended that in several years. I think sometimes when it's closer to the border, maybe we have some interest. We won't have any staff attending. Actually, probably no staff attending most of these conferences this year. So it would be up to the councillors' interest to attend, and they can identify that to us if they wish.
Thank you. I was just wondering if there was a specific highlight or a specific point on there that would jump out, or is it just really a general agenda for the conference?
No, it's just a general agenda, and we try to provide these conferences to remind councillors early that these conferences are available for their attendance if these are areas that they want to explore more or have a specific interest in. So the Public Works one is an excellent one if that was an opportunity.
Okay, many thanks. Appreciate that.
Okay, thank you. Warden Weaver, I believe you have your hand up.
Just comment on these information reports, the first quarter statistics and all of those things. I think it's great to hear of the activity that's going on with planning. Our staff have continued to provide services across the county, whether it's planning to keep things going through this COVID. So I just wanted to, you know, it's really great to see the activity, the number of buildings, permits and stuff that's going on. And kudos to staff for doing that under situations, whether somewhere at home or part-time and back and forth. It has been an extra effort, but really the county has not suffered from lack of ability to make these things happen for us. So I just wanted to say that when we received these reports, they're all good new stuff.
Thank you for that. I couldn't agree more. It's particularly interesting too to read that despite having to, you know, implement extra safety protocols and so forth, that the work does continue. So my appreciation as well through the staff. And great point, Ward. And thank you, Mr. Cole. Any other questions on these reports? Okay, I believe I have a motion and a seconder already. Look for a vote. All in favor of receiving these reports? That is passed. And we have two reports requiring a motion. We have a County Roads in St. Clair Township report and a Point Edward County Road Maintenance Agreement report. If nobody objects, I will look to, I'll move those separately. So we'll start with A, the County Roads in St. Clair Township report. I'll look for a motion. Councillor Veen and a seconder. Warden Weber. Any questions on this report? Our recommendation. Yes, Councillor Veen.
So, looking at the Highway 40 and the County Road 2, so they don't want to put up lights or anything there?
Through you, Mr. Chair, maybe I could direct that question to Matt DeLine, our Manager of Public Works.
Yeah, through the chair. Through discussions with the MTO, they, under their warrant policy, do not seem illumination to be warranted there. They're looking into it. Like I said, that further correspondence about the work they're going to be doing along that corridor. They're going to be looking at auxiliary lanes and other illumination, but we'll be at the behest of them to see if it's going to be warranted or not.
Thank you.
Any further questions on that motion? All in favor? That is passed. And item B, the Point Edward and County Road Maintenance Agreement report. I'll look for a motion for that recommendation. Councillor Miller, Warden Weber seconds. Any questions or discussion? Seeing none. All in favor? And that is passed. Is there any other business for infrastructure development?
Mr. Chair, if there's no other business from the councilors, and I'll wait to see, I have one item.
Okay, looks like you can go ahead, Mr. Cole. Thank you.
Thank you, Mr. Chair. The Ministry of Environment is currently developing a regulation to transition blue box responsibilities from municipalities to producer organizations. This is generally seen as a good thing. It's going to transfer that cost to the producers and free up our own finances. The regulation is scheduled to be available in the fall for public comment, and the blue box responsibility transition is supposed to happen from 2023 through to 2025. The county's been participating in the province's joint working group for this transition regulation development. And as part of those discussions, there is a concern that's been brought forward, both noted by us at the county and through AMO, and that is that the province, there is some suggestion that the province ties that regulation to other existing language for responsibilities that would only make that regulation a requirement for municipalities over 5,000 population. Now, in Lambton County, 6 of our 11 municipalities are under 5,000 population, and all of them have blue box programs that they provide. So this would mean that there's the potential that producer organizations would not be responsible for 6 out of our 11 existing service provision of blue box to our municipalities. AMO identified this specifically in an email that they sent out last week, asking municipalities to put forward a motion to encourage the province to make sure that all municipalities maintain their existing services, blue box services, under the new regulation. And I think maybe if this committee wishes, I could bring a resolution forward based on AMO's recommendations to council. So we didn't have time to produce this for committee in a report, but we could do so to a report to council with the designation or with the corresponding resolution.
Okay, no, that's a very valid concern. I mean, first off, I'm glad the province is continuing on with the process. It's been a number of years in the works, but that's obviously a major gap. Would you require a motion then from this committee to present that to council in July, or?
I think motion or direction either would be helpful. Yes, just to be firm on that, clear on that.
Okay, I'll look for a motion then to direct staff to provide that recommendation for the July meeting. Councillor Bean is making the motion, and Councillor Ferguson is seconding the motion, I presume. Okay, any discussion on that? All in favor? That is passed. Thank you. Thanks for raising that with us today, Jason.
Thank you.
Anything further? Okay, we're moving on. Thank you so much, Mr. DeLine and Mr. Cole. And we're on to public health services. We have one item of correspondence to receive from the Board of Health from Simcoe Muskoka District Health Unit. Looking for a motion to receive this letter. Councillor Ferguson, Warden Weaver seconds. Any discussion? I see none. All in favor? And that is passed. We've received that. There are 3 information reports. 2019 Ambulance Response Times Report, Air Quality and Extreme Temperature Initiatives Update Report, and a Vector-Borne Disease Program Update Report. I'll look for a motion to receive all 3 of those, please. Councillor Ferguson, Councillor Napper seconds. Any questions? Councillor Bird.
Thank you. Through the chair to staff, I'm just curious on why the timing targets are set so low on that report when clearly by reading through it all, you obviously can exceed those times. So why do you set the targets so low?
Through you, Mr. Chair, Steve Pansino's on the line, and I will let my EMS manager speak to the targets that are set for the EMS outcomes.
Okay.
Thank you. Thanks for the question, and through you, Chair. Those numbers are set on historical submissions that have been made when the ministry first adopted these requirements. They are set by council, and we've maintained those from previous submissions. We do continue to monitor them. We have the ability through council to update them or change if that's the direction. But as you indicate, they are set so that they are set according to the response time targets that we feel we're able to meet given our current resources.
Thank you for the reply. It just, for someone reading all these numbers and targets, it seems a little strange. If they're set by the province, is there no way based on everybody's results that they can be set a little higher? Because for the reader, think, well, you have an emergency and you have a response time that's expected, and obviously everybody in the public expects it to be the best there is, and you've clearly exceeded them. So is there no way that even our county can contact the province to say, can't we up these targets so that it looks more impressive? I mean, it really doesn't look so good to see lower targets.
So, sorry, just to be clear, those targets are established by the county, and we report those into the ministry.
Okay.
There has been attempts over the previous few years amongst different paramedic services to somewhat align what their targets are for that reason. So it really is up to each individual municipality or county to set those levels. They are, however, required by the ministry to meet those levels. So there's a little bit of a give and take if some regions opt to make their targets lower, therefore they're reaching them. Others will sometimes set them higher, and if they're not reaching them, then they have to address that. So there's a bit of a balance there. And certainly we can relook at those if that's something that council desires.
No, and thank you for the response. I understand that, and I understand why they do it, but I'm thinking if your results have been so good and your response times are recorded continuously, say for 2, 3, 4 years or whatever, then I think it would look good if we could reflect that in the actual target. So it's just a thought for consideration.
Yeah, absolutely. We'd be more than happy to do that. And again, I think it's also important to note it is only one of the metrics that we do look at. So there are many others. And if there were, if the department or my office was concerned about our ability to respond, certainly we, council would be hearing about it prior to, the annual report that we put out.
Okay, thank you.
Thank you. Any other questions on those 3 reports? I know I had one, Mr. Taylor, on the air quality and extreme temperature initiatives update report. Just in regards to the current situation for cooling centers, were any alternate locations identified or required during the first heat warning of this year?
So no, we did reach out to the lower tier municipalities. You may have seen a letter that had gone out requesting municipalities give us some information. So at this point, I understand it's only Brook Alvinston that has identified a cooling center. And the other good news about this is, in speaking with my colleague from social services, is what I understand is a number of the vulnerable clients who would typically utilize this messaging, they've actually been housed in Sunbridge due to COVID. So that has also assisted us greatly in this with this initiative. And other than that, our messaging is ready to go out, and we're confident that it'll get to the community partners. So that's where we are at this point.
Great, thank you. Okay, we have a motion to receive these reports. All in favor? That is passed. Any other business for public health? I see none. And is that from staff as well? It looks like I see none. So.
Nothing else to report. Thank you.
Thank you, Mr. Taylor. Okay, moving on to cultural services. We have 2 reports requiring a motion. We have the library's donation report, January 1st to April 30th, 2020, and a collections management and donations report, January 1st to April 30th, 2020. So I'll look for a motion on the first one. That's the library's donation report. Councillor Ferguson and a seconder. Councillor Bird, any questions? All in favor? And that is passed. And the second recommendation, the collections management and donations report. Do I have a motion for that? Councillor Napper, giving seconds. Any questions on that? Sorry, those were hands anticipating a vote, I assume? Okay, all in favor? And that has passed. Okay. Any other business for cultural services? Yes, Warden Weaver, and then Councillor Bean.
Just through to Mr. Meyer, the stage 2 now allows us to go to open our galleries and museums, and I know there's information about that in the reports, but is there any updates since those reports where we are planning, or do we have any timing, I guess, in how to facilitate the museum? People are still looking for things to do out there, and certainly see what we can do. Any update on that? Just
certainly, I'd be happy to provide an update through the chair. Thank you for the question, Warden. We are actively looking to recall additional staff from cultural services in our libraries, museums, and gallery to prepare for stage 2 reopening. As some of you may be aware from the details that were announced by the province in previous weeks before we Lambton County reached stage 2, what we're looking at is adapting to limited site access to the public controlled entry, and also looking at ticketed entry and entry by appointment. So that will be sort of the next phase for cultural services such as museums and galleries. The rate at which we move into that phase will depend on a number of things. First and foremost, getting our facilities ready to ensure that they're safe and that measures are put in place for both the public and for staff. So the first step, we're working with the union executives this week to start the process for a recall. And from there, once staff return to work, they'll be working to help put those measures in place to ensure physical distancing. And then we will be providing further updates to council and eventually, of course, to the public on our phased reopening into stage 2 and providing access to the public.
Thank you. Councillor Bean, you had a question?
Yes, thank you, Mr. Wade. Andrew, the Oil Museum was going to have a car show this summer. Is that still going to go ahead?
Through you, Mr. Chair, thank you for the question, Councillor Bean, and unfortunately not. We, as you say, we did have plans to celebrate the 60th anniversary of the Oil Museum, and like many community events, it's been impacted by the restrictions under COVID-19 related to gatherings. So we made the difficult decision to postpone that. We are working on a bit of a press release because we know there are questions out in the community, and this will likely impact other significant signature events that are coordinated by cultural services, like the craft sale upcoming in the fall. So we will be communicating that out to the public, but for July, for the Black Gold Fest and the car show and the anniversary, that will also be canceled. So you'll see a communication on that shortly.
Okay, thank you, sir. We look forward to hearing about the 61.5-year anniversary event as we're able. Okay, any other new business for cultural services? Seeing none, thank you, Mr. Meyer. Appreciate your time as always on these excellent reports. And moving on, it is recommended that the chair declare the committee go in camera to discuss the following: a report to provide an update on the progress of the new lease agreement at Bayside Center, City of Sarnia, and to provide instructions in relation thereto pursuant to the Municipal Act. Do I need a motion for that?
Can I have a?
Yep.
A comment before we go in camera, because I know that there is public watching this and they're going to be gone. And I just want to relay a message from the county about the good work that we've done to get us to stage 2 across the county. Those staff that have worked hard and everything. And a reminder to everyone that it's not gone away. We have to continue to be respectful of the rules and the regulations, and just a thank you, and please be mindful, be kind to others, and carry on with the work that we've done. And just a short message for the public as we go out of the public portion of the meeting. On behalf of the county, thank you.
Thank you, sir. Okay, I'll look for that motion to go in camera. Councillor Bean, seconder, Deputy Warden Marriott, all in favor? That's passed, and we will now wait for the stream to cut out. Thank you all for tuning in.
For members of the public, we will now, once we go into camera, we will now cease the broadcast of this council meeting, and once we are concluding in camera, we will just be adjourning this meeting.